MRI. Are there any MRIs here? So we can, let's see, just CT scans, no MRIs. Just let's see here. We have a left knee MRI. I'm downloading it. It says this patient has gone through surgery for some patellar disease. He also has arthrosis and has been complaining of pain, edema, and limitation to walk and to move the knee. So yep, this isn't good. This looks like not as bad as it was described, but it's really not normal. We have a high riding patella right there. We have it's a type 2 Wiberg classification. We have superficial chondral erosions right there and deep erosions right there on the trochlear region of the femur. Also, the trochlear sulcus is flat. The patella is high riding, and there is bone edema, subchondral bone edema right there and right there. So there is mild arthrosis. In these settings, tiny osteophytes. There is also a small joint effusion. We have a thickened and heterogeneous patellar tendon right there. Let's see. The lateral meniscus looks fine. Also, the medial meniscus looks fine. Anterior and posterior cruciates are all right. My cell phone just fell down. Just going to put it up again. Yep. And collateral ligaments look okay. And I guess there is also, there is also some signs of a surgical procedure right there on the medial patellar retinaculum. These ligaments hold the patella in place, so this patient clearly had an event of a lateral dislocation of the patella, and it was put back in place and surgically corrected sometime in the past. And we also have some edema on the soft tissues anterior to the patellar tendon, which could be related to a mild pre-patellar bursitis. So I guess we have all that we need, and we also only looked at 2 sequences of this knee. Let's grab a T1. Yep, it's there. It's really arthrosis, mild arthrosis, patellofemoral arthrosis, and indeed there is a diffuse and advanced tendinosis of the patellar tendon. There is even a small fragment of bone right at the distal portion of such tendon. So this isn't a good sign. There is fibrosis right there, fibrosis and diffuse signs of a post-operative setting, a operative procedure, a surgical procedure, and there is clear signs of fibrosis on the infrapatellar fat pad, which is quite common whenever the patient goes through surgery like that. This isn't much. This is what it is. So lateral meniscus seem fine. Medial meniscus also just a mild heterogeneity, mild heterogeneous signal in its substance, particularly on the posterior horn, nothing much. The chondral surfaces are fine. Collateral ligaments also, and we have indeed a post-surgical setting of a surgically corrected lateral dislocation of a patella, which in itself is high riding, and also the femoral trochlear is flat, is shallow, which are signs of a instability, a patellofemoral instability complex. So I have a normal template for this because this isn't quite common. So I'll grab a normal template and I'll just describe finding after finding in a orderly manner so it makes sense to whoever is going to read this. So most bone and cartilaginous structures are fine, just describing the arthrosis of the patellofemoral compartment.